So what is community paramedic? Community paramedicine, it's relatively new and it's an evolving healthcare model. It allows paramedics to operate in an expanded role by assisting with public health and primary health care and preventative services to underserved, at-risk and/or identified populations in the community. Community paramedics generally focus on connecting clients to primary care, doctor, nurse practitioner, other social services, and other healthcare agencies. Our integration with local public health agencies, home health care agencies, health systems, primary care, and other providers, like I said, nurse practitioners, doctors, anybody else who's looking after your health. We provide assessments, monitoring, and treatment in the community. Our main goal is decreasing 911 and ER use while improving health and social outcomes for our clients. But we also don't want to duplicate services available in the community. So if we find that we're duplicating, we will step back. Community paramedics. Our client base is those that are at risk of vulnerable medical complex. Sorry. Our goal is to improve health outcomes and allow clients to stay in their homes. That's our whole goal. You don't want to go to the hospital. Nobody wants to go to the hospital. So if we can help shave off a couple trips to the hospital, then we're happy. You're happy, we're happy. We have a proactive care. We're non-traditional. We work with isolated, frequent users, those that have low service. Our main intake goal is for COPD, CHF, and diabetes, the folks with that. We do assessments, referrals, education, point of care treatment. We look at living conditions. We make sure we have food security, unique chronic care and emergency care. We build relationships and trust, supported by various agencies and partnerships and studies. So community paramedics started in Brantford in February of 2015. Glenn was on one of the beginning roles and he has helped expand it out to what we are today. When we first started, I'll just give you a little background. We were in a little one office in the middle of an old Bell building. There was 5 community paramedics and Glenn. So we had one program and now we've expanded out to 3 different desks, pushing on to 4 hopefully, but we can go through that right now. We started clinics and home visits and we were only 3 days a week back then. Now we currently have multiple programs. As you can see, we have what we call our community paramedic core desk that works 6 days a week, 12 hours a day. We're not in, that desk isn't in on Sundays. We have our community paramedic long-term care that works 7 days a week, but that's available 24 hours a day. 12 hours of that day would be home visits. And then the other 12 hours is like a phone, you phone in and it's answered and they do like a phone assessment and then decide if you need to go on to the hospital or if it's just something that can wait till the team's back in tomorrow morning. We also have just launched this year our expanded services program. That's 7 days a week, 12 hours a day. And we'll get into what each program is a little further on. We're approaching 5,000 interactions annually. We do procedures and we work very closely with your primary care team. Again, nurse practitioner, doctors, whoever's involved in pharmacists, whoever's involved in your healthcare team. We work with home and community care and we work closely with the hospital as well. So this is our core program. This is generally where most of our clients start. It encompasses all the features of our paramedicine program. As I said, it works Monday to Saturday, 7 to 19, or sorry, 7 to 7, used to military time. They do home visits. That desk does home visits. Currently, their focus is mitigating decline among CHF, COPD, and diabetes patients. However, if you have a patient that you feel may benefit from our services, or folks you think we might be able to help, please give us contact. We always look at, Glenn and I always look at case by case, and if we think we can help, by all means, we'll get our team out to you. We also do wellness clinics. We work with housing, and we go into housing buildings, and we do some private buildings. We currently have 10 buildings in total. All building residents are welcome to attend our clinics. We don't go by the CHF, COPD, diabetes. So everybody's welcome to come down. And we also do, that desk also does remote home monitoring, which we'll get into that a little bit better later as well. My tech support just. Okay. So community paramedic, what we call our long-term care desk, we were one of the first 5 services in Ontario to be the pilot for this new program a couple of years ago. We do have 57 services in all of Ontario, so it was a great honor for us to be included in that pilot project. That desk works what we call 24/7. So like I said before, there's always a team member here Monday to Monday, 7 to 7, and then our phone gets forwarded at nighttime where they'll speak to another paramedic. It's usually the road supervisor, and they do an on-phone assessment, or if it sounds pretty bad, they're going to run out there and go see the client, and then they're going to make one of 2 decisions. It's either they're going to send them off to the hospital, or they're going to get them to the point where we can see them the next morning, but they would be first on our priority list. So that desk also focuses on providing care to residents who are on a long-term care wait list, soon to be on a long-term care wait list, or they have been accepted, but they're opting to stay at home. And again, our goal is to keep people in their home because that's where they want to be. And if we can help with that, that's great. That's our job. Program goals are to provide supplemental supports to provide safe and prompt care for matters not requiring treatment at the hospital, and to ease pressure on the long-term care wait list while allowing people to remain in their homes. And we also like to help assist with caregiver burnout as well. We just don't look at the client. We try to look at the whole family and the whole system that's supporting the person that's our client. So our target population for our long-term care program is patients requiring supplemental community paramedicine services beyond home and community care. So again, we want to avoid going to the ER. Folks that are in the ER and being discharged out. We also work with the hospital, and they make sure that they send us a referral so we can get in to see those folks as well. Patients waitlisted for long-term care residing in the community or soon to be active in long-term care. The profile includes complex needs, generally frail with multiple comorbidities and requiring more than visit-based care. So they get to see our team a little, they're kind of like the progression on from our core desk. We see them a little bit more often. So, and they're also our main team for remote home monitoring, which we'll get into a little later as well. Seniors, others with similar needs in the community at high risk of hospital admission and becoming designated long-term care, including individuals experiencing frequent hospital readmission and those recently discharged who are at risk of hospital readmission. We want to stop that. Nobody wants to go back. So Atonics, that's the company that provides our remote home monitoring program. We've just switched to them. Very much better than our old program, and we're really pleased with it. So what is remote home monitoring? It monitors what it is. It's a set of equipment, and we send it out with our team, and we spend about a good hour with our client. And what it does is it monitors blood pressure, SpO2, heart rate. And if you're a CHF, a person with congestive heart failure, we have a scale that goes out so we can monitor the weight as well. So what happens is they get a tablet. They're reminded every morning. or afternoon, whenever they want to take their vital signs, and it's reported back. It gets reported back to our office. So if we see anything out of the ordinary, the team's right on it and they call to make sure everybody's okay. So it's another set of eyes on. Let's see where else. So Queen's University did some data analysis for remote home monitoring, and they found that we're getting 5 times the return on our investment, the whole healthcare system. It's been proven that there's 40% reduction in readmission in 30 days with this equipment because we're catching it faster. The cost is $30 million, but it's also saving $150 million. Other features is with Atonics, we can also, because it's the way the program's set up, we can also add in family practitioners, pharmacists, so everybody can be on board to help with the whole picture of the healthcare for the client. It's also a tablet, so there's virtual video assessments. So if we can't get out to you, maybe that day we could do it, but you have a tablet, we could do a face-to-face, just like a Zoom meeting. So very helpful. And everything that's on there is secure. And we can also do texting. Quite a lot of our clients text and say, hey, I'm just not feeling well today. So we can get ahead of that as well. So, and it has reminders to do your vitals. It beeps. We do have a new program that we started last March, and it's called Expanded Services. I'm not going to lie, this was kind of my baby. It's funded by Ontario Health West, and we have funding up till March 31st, 2023. So currently, it operates with clients with mental health, addiction supports. We go out with St. Leonard's, the Coast team, and we see people who are referred to us by the road crews. We do data pulls, we do cold knocking, current CP clients. So basically we go out and we just make sure those folks are okay. We get them some resources that they need. Sometimes a lot of people don't know that there's resources out there. We also partnership with what's called the Brantford Downtown Outreach Team through the GRCHC and St. Leonard's as well. And what we do is we go out and we help those that are homeless and underhoused. We meet downtown. Ourselves, 2 social workers and a nurse practitioner go out and we see if anybody needs any medical assessments. Do they need some referrals? Any vaccinations? We take the flu shot with us to make sure everybody gets flu shots. And we make sure they have food and clothing, and we make sure socks, because socks is a huge deal for those folks. So we try to help where we can there. We also do a falls prevention program and follow up. Again, we do a data pull, and I make sure that anybody that's had a fall, our falls team goes out, and what they do is they go in and they find out, why did you fall? Is it because you're dizzy? Is it because you got a shag rug in the way? And we try to make sure that they get all the help they need there, even if it's just changing furniture around, or we'll get occupational therapy to come in and help with walkers or grab bars or something just to make it safer. We've just recently expanded out into the youth support program. So what we do is we go down and we work with Woodview and we work with Why Not, and we try to educate the kids into when to call 911. We give them a little bit of a background on CPR, how to run a defibrillator, allergies. We show them how to use an EpiPen. Our one gentleman, he's now into the public schools and to the high schools, and he does a 2-hour presentation there as well about the same thing. We've also just received our virtual reality kit, and we are using that for social isolation, and our palliative team will be taking that out as well. So what it is, it's called virtual reality. It's a program called Rendeavor, and we can bring anything to you basically. So if you're from Italy and you can't get back home because of your failing health, we can bring Italy to you. And it's a headset that they put on, and if Google Maps has been there, they tell us, we can show them the house they grew up in. If you've never been to Venice, we can take you on a video on a gondola ride. So we're very excited about launching that out in the new year. So Haldeman County has used it for a while and they said they've had great results. So we're very excited. So medical oversight, how do we get to do the things we get to do? So we work with primary care teams. Again, it'll either be your doctor, your specialist, a nurse practitioner. We'll even talk to a pharmacist. We get order forms from the physicians, and any requisitions we get from the doctors and the healthcare team as well. So this is some of the services we offer. When we go out, we do assessments. We refer on if we think they need something through St. Leonard's or the Lynn, we can do referrals. We also give injections, for example, of B12, B6. We do Prolia injections for folks who need their Prolia done. We've also done allergy injections for people as well. We do immunizations. So we're just finishing up our flu season. So we got into all 10 of our buildings and our home clients. We did that as well. We do Libre and Dexcom changes for folks that are diabetic. IV initiations, we can do 12 leads. We do point of care blood testing and blood work. We do 12 leads and HbA1c point of care testing. So we bring all that to your house, and this is at completely no cost to our clients. So a lot of the doctors are really happy with the blood work we're providing. It's just a basic panel, but again, if we can save a trip to the doctors or bring it to you, then we're very happy to do that. So who generally refers to us? Primary care teams, the hospital, home and community care, our road paramedics that have come to pick you up. If they think we can be of service, they'll send a referral to us and then we contact and go see. You can refer yourself, a family member can refer you, or a friend. And various other health and social services groups will refer on to us. We've had them from the Alzheimer's Society, anybody who thinks we can help. So how do you refer to us? You can contact us by phone, email, fax. We do have a website. There is a link on there to fill in a fillable PDF, and you can refer that on to us. So we'll see anybody with COPD, CHF, or diabetes, or anybody who requires support for unmanaged conditions. We'd rather have the referral and figure it out if we can help, or if we can send it on to somebody else. We just don't, we always make sure it gets to somebody, and then we'll get in touch and let you know where we're going with that referral. Any other conditions, procedures that may benefit from us, we're more than happy to have a look and help. So this is just kind of a little graph showing the difference between our two programs. As we've already mentioned, identified by care provider with concerns that we can help with. So this is our program information. We have a medical information sheet. We have brochures, which Glenn has attached that I think are going to go up. And brochures, our brochures, we have two different kinds, one for our clients and one for caregivers, and one for our primary care family team as well. So this is what our medical information sheet looks like. When we come out and we do our, when we come out and we do our initial intake, this is brought with us and it gets all filled in. So it's put into a package. We're going to start putting them into packages for our road medics as well. So if you do have to call, everything they're going to need is right there. Kind of speeds up the process. And it also helps any future new community paramedics that come in as well get to know you real fast. So this is another one. And this is our contact information. Feel free to email myself or Glenn. We'll get back to you within a day or two. And thank you again so much for having us. Any questions?
Well, it's going to be my